Now that you understand a little bit more about why the cranial cruciate ligament is important and that the knee's unstable when it's damaged, we're going to talk about the surgery that's involved in restoring your dog to pretty close to normal function. The surgery we're going to talk about in this video is extracapsular repair for cranial cruciate ligament disease. Now, this procedure is a viable option for small dogs and cats under about 10 kilos. If you have a large dog, please check out our video on tibial plateau leveling osteotomy, which is the gold standard technique for this condition. If you remember from the last video, this is the weight-bearing surface of the tibia. The weight-bearing surface of the tibia slopes backwards, acting like a hill. If the cruciate ligament is damaged, the knee is unstable because the bottom of the femur, which acts like a ball, rolls down the hill and the knee gives out. The extracapsular repair surgery involves placing a prosthetic ligament on the outside of the joint that is in an orientation similar to the original cruciate ligament. We anchor the prosthetic ligament behind the fibula, which is this small bone here, and through a bone tunnel in the front of the tibia here. The implant holds the joint stable and prevents the knee from giving out during weight bearing. The implant works like a scaffold, and over time the body puts down fibrous tissue around the implant to stabilize the knee long term. The outcome of this surgery when performed in small dogs or cats is generally very good, with about 90% of animals returning to lameness-free activity. After the post-op rehab, the expectation is that your dog or cat should be able to run freely without detectable lameness. So now that you know a little bit more about the surgery, please check out our video on post-operative care so that you know how to look after your dog once they get home.